Good morning or good afternoon, everyone. I'm Jingdong Li from HL7 China. My report is HL7 in China. I will cover 4 items: HL7 and HL7 China introduction, interoperability and the needs of healthcare information standard, HL7 China standard development, education, and conformance testing, the current ongoing work and challenges. HL7 International was founded in 1987. It is a not-for-profit organization dedicated to providing a comprehensive framework and related standards for the exchange, integration, sharing, and retrieval of electronic health information. Since 1987, HL7 International has developed a long list of standards. So I put these primary standards in this slide. You can see the CCDA. The CDA is a clinical document architecture. It's a standard for the electronic clinical document exchange. The CDA Release 2, the FAIR Release 4. FAIR it means the HL7 Fast Healthcare Interoperability Resources. It's an abbreviation of Fast Healthcare Interoperability Resources. And HL7 Context Management Specification, CCAL. HL7 version 2. HL7 version 2, we also call it the messaging standard. So HL7 version 3, so it's also referred to the RIM standard, Reference Information Model standard. So among these primary standards, the CGA Release 2, FAIR Release 4, and HL7 version 2 are the most used standard in China. HL7 China is an affiliated organization of HL7 International. It was founded in 2006. So now it is 14 years old. HL7 China's activities mainly in 3 areas. They are standard education, standard development, and standard testing. So the standard education takes upon at least 60% of HL7 China's activity because of China has a big shortage of HL7 standard professionals. So the next slide, I will briefly talk about interoperability and the needs of healthcare information standard. What is the interoperability? Interoperability means the ability of health information systems to exchange, share, and understand each other's data to advance to better healthcare services. So today we are in data age. Hospitals and public health agencies have accumulated huge amount of data. We wish we can unlock this data, use the data to achieve better healthcare outcome. By sharing the data among different public health agencies, we are able to early detect disease outbreak event. By sharing the data among different hospitals, we can avoid redundant medical exam, such as lab tests or radiology examinations. to lower healthcare cost. But the reality is that when we deal with the healthcare data, we often find the data quality is not good. Sometimes it's bad. Because there's no data standard imposition, the data for same information from different hospitals and organizations are often very much different in terms of format, granularity, and wording. So these are big barrier preventing us from effectively using and sharing healthcare data. To overcome the barrier, I believe the right answer is standard, is HL7 standard. So if you look at the lower left corner, the diagram, if 8 hospitals would like to share data among them without having that standard, each hospital has to develop 7 different data exchange interfaces in order to exchange data with the other hospital. So it's a big burden. But with HL7 standard, each hospital only need to develop one data exchange interface. And that interface will send out the standardized data, will receive and process the standardized data sent by other hospitals. So that's a dramatic reduction of development time and implementation effort. Another example is the upper right corner. So HL7 standard not only defines the data exchange format, it also defines the semantic model, clinical concept semantic model. So this is the model defined by FAIR. This is the medication model. So this model contains all the information pieces, or it contains all the child data elements regarding a medication, such as medication, the drug name, the frequency, the start time and end time of drug usage, and the dosage, the route, manufacturer, ingredient, so on and so forth. So based upon this model, different organizations can develop very same medication data stream. And that will significantly improve the data quality when this data is shared among different organizations. So by adopting HL7 standard, you can see the data exchange is much easier, and the data quality will be improved significantly. And finally, we can achieve the goal of unlock the data, fully utilize the data, and to get the maximum data value to support different clinical healthcare scenarios. Next, I will talk about HL7 China standard development, education, and conformance testing activities that we have done in past years. Standard training. China has a big shortage of HL7 professionals. In order to cultivate HL7 China community and HL7 professionals, we have a biannual CDA education event. We have a biannual V2 message education event. We have a biannual fire education event. So this event normally one is held in the northern China, another one is held in the southern China. So for the people to participate more conveniently. We also encourage the HL7 China's member to take HL7 international certification, such as the CDA certification, FAIR certification, V2, and V3 certification. The HL7 members certified in different standards are published in the HL7 China's website. So these pictures are taken from the different education sessions. You can see. Standard development. HL7 China did a survey, then found out there are demands for sharing clinical document between hospitals. And patient also has have demands to have the clinical document in hand. So after they went to big city to see the doctor and back to hometown, they can present provide the clinical report to the physician in their hometown. HL7 China has developed a list of CDA IG. The implementation guide includes inpatient medication record summary, adult physical exam report, inpatient discharge summary, outpatient clinical visit summary, and a lab report. So we have used the Lantana Trefolia tool to develop and publish the CDIG. All the IG was available publicly, and they can be downloaded from the HL7 China's wiki page. So here down below is the entry template of CDA inpatient medical record summary IG. So you can see it's structured, it specified the code, the relationship, the cardinality of the discharge medication entry. Standard testing since 2018, HL7 China uh, has held Fair Connect-a-thon annually. So there are many China HIT vendors participate the Fair Connect-a-thon to test their interface, to test their level of conformance to FAIR standard. So the current testing scenarios covers the patient appointment, surgery, medication, as well as terminology. These are fair resources. The tested scenario include creation resource, update resource, retrieve resource, and delete resource. So here's the pictures that was taken from the CHIMA conference, the testing, the Connecton testing room. Next, I will talk about the current ongoing work and challenges. Ongoing work. We plan to develop fair resources in China realm. The first batch of fair resources are essential data elements in healthcare settings, such as patient, provider, encounter, diagnosis, lab observation, medications, so vital signs, etc. We are developing a fair testing server so to support the near future fair standard conformance testing. And we have made pretty good progress. Hopefully, in October, we can have this testing server up and running. We plan to develop fair implementation guide. Also, you can call it fair profile in China realm. The implementation guide will be in certain disease domains, such as cardiovascular disease or neurology disease. Besides this ongoing work, we will still perform the regular activities such as standard training and fair connector testing. Challenges. HL7 China, as a not-for-profit organization, faces some challenges. Challenge one is all the members are volunteers. All the work was done voluntarily. Because all the members are volunteers, sometimes a project was set up. It is difficult to advance according to the schedule. And because of the volunteer-based, sometimes it's hard to maintain a stable workforce for continuously IG development. So another challenge is the shortage of HL7 professionals. China still have a big shortage of HL7 professionals. So HL7 China will do more training, more education session to overcome this shortage. Currently, HL7 China community members are mainly from HIT vendor. Most of the members are software engineers. There are only few members from healthcare settings. So we need to bring more healthcare professionals into HL7 community in order to produce the implementable the meaningful, the problem-solving implementation guide and standard. So that's another barrier, another challenge that we need to overcome. This brings to the end of my report. Thank you very much for listening to my report, and welcome to join HL7 channel. Here's the HL7 channel's website, as well as my email contact. By the way, this is my first time to do the recording meeting. I'm not used to it, so I apologize if there's any inconvenience to you. Thank you very much. Bye bye.